I haven't really shared this part of my story, but I'm not a compliant patient. I mean,
Mhm.
you can see that as far as the doctor asking me to do the testing, and it took me 9 years, but I'm also not anyone that goes to the doctor. I have a busy schedule, busy life, and women are tough, and we just don't go to the doctor. And when you look at the vague symptoms of ovarian cancer, bloating, what woman doesn't have bloating? Feeling full when you eat. Well, okay, isn't that what we're supposed to do when we eat is feel full?
Yeah.
I mean, all the things. The vague symptoms of ovarian cancer never would have sent me to the doctor. I would have been stage 4. Everyone that knows me knows that's true. I would have
Yeah.
been stage 4 when I presented, and I wouldn't be here. So I owe my life to genetic testing. I really believe I do. And so my I'd long been an advocate for patients from the time that I had my breast cancer diagnosis. I've been involved with American Cancer Society for many, many years in many capacities. I'm a voice of hope for them nationally. I've done many things with them, but they weren't really doing anything at that point in the hereditary cancer space. It
Yes.
wasn't getting any attention.
Yeah.
So
I,
at that,
I, I
yeah,
want to get to your advocacy work in a minute. I want to dig
okay,
into that in a second,
okay,
but I want to go back and make sure that those who are listening understand how significant the decision that you made to go through the prophylactic mastectomy and removing the ovaries and uterus through that surgery where they found ovarian cancer at its early stages. Ovarian cancer is referred to as a silent killer because it, like as you said, it's kind of symptomless. Do you
right,
feel full? Sure. Are you bloated? I'm bloated right now. So these types of things. And 70%, nearly 75% of women are diagnosed with ovarian cancer in the advanced stage. So that's a major decision. What was the conversation like, not only with your doctor when you had the conversation, but also as you shared that with your family to also get tested? Like, what was the impact even broader than just your decision?
well, everyone understood the importance at that point. I'm not gonna say everyone jumped in immediately, but it didn't take long, and I can say that all of my first-degree relatives have tested.
Mm,
All but
okay.
one of my second-degree relatives have tested. Many of my third-degree relatives have tested, including we just got a result last week, from someone who had not tested, and she finally did, and, so, we have 8 family members known to share our mutation now, including a couple of my children, and so I have grandchildren at risk. So
Mm,
this has been totally empowering for my family to know, um, so that they can be proactive in their own healthcare. I have a brother who shares my mutation, a brother and a sister,
mm,
and I'm one of 5, so 3 of the 5 of us share the mutation, and my brother does everything that you should do. I mean, he's like the poster for a man to follow. Does everything. He goes every 6 months. I mean, he has an exam. He goes for prostate screening. Pink. He does skin screening. He does breast screening. You know, I'm trying to talk him right now into the getting into the Precede consortium for the pancreatic screening, because 'cause I'm doing that as well out of UT Southwestern. And, just, we have a family history, and to catch something early means all the difference.
yeah,
But yeah,
absolutely.
another thing for ovarian cancer, they call it the silent killer, they also call it the cancer that whispers.
Oh,
And I don't I don't listen to whispering very well. You have to yell at me to get my attention, and so, that when we came out of surgery and I found out what they had found. I mean, I was as shocked as they were. We were all shocked. I mean, totally blown away.
yeah. I'll say this: I'm a leadership uh, coach for medical and pharma sales organizations, and I always have tried to instill in leaders that lead and motivate leaders. You really have to value the work that you do. Like, to be in this field, in any field, but especially in healthcare, and have the privilege of marketing a product or a service that can help a cancer patient. Because my father is a colon cancer survivor. To really value what you do, because as you mentioned, you live in East Texas, and there was a sales rep, and as I understand, you recently spoke at a Myriad national sales meeting. Can you just speak to um, how important a job they have? Because folks in the industry listen to this. In spite of the challenges sometimes they have with getting in and actually having a meaningful conversation with a healthcare provider, how important their job is to educate the medical community about not only hereditary cancer testing, but other genetic tests that can inform care. What's at stake each day?
You know, I see all of those people, no matter what the company is, I see them all as superheroes, I honestly do.
Hmm.
Because I mean, they all need their capes because they are going out and they are having a hard time getting in to see doctors. I mean, that's just the way it is. But what job do you have that you can actually go in and sell something that can potentially save a life? It's not like you're selling, and this I'm taking this actually from what my Myriad friend Bill shared recently at that conference. But what other job can you have that you can actually it's not like you're selling a car that they don't need or something,
Yes.
this
Yes.
is something that people can benefit from. And after we met, several years ago, he had been telling my story but didn't know my name, HIPAA and all that, and after I was several years into the My Faulty Gene, our nonprofit, um, we met, and he realized who I realized who he was and his role in all of that, and it was kind of an interesting thing. So that was maybe in the summer. By, Christmas, I sent an edible arrangement, okay, to him for his family for Christmas. And they delivered it. He tells this story. He said they delivered it. Everyone's like, "Who's that from?" And he said, "I don't know. Let's look at the card." He looks at the card and it said, "Thank you for the last 13 years. Love, Kathy Baker."
Uh,
He said, all of a sudden, his kids are like, "Who is Kathy Baker?" And he said, for the first time in their lives, they understood that what dad does makes a difference. And he became a superhero to his kids. And since then, and since he knew my name, he's kind of got this thing as he tells his reps, "Go find Kathy." How many Kathys are there out there?
they're
How
out
many
there.
women? I spoke
Yes.
at a UT, East Texas medical breast cancer event this last fall, and, um, after I shared my story, all of these women who were breast cancer survivors were just lining up, wanting to get signed up to do genetic testing because they realized it doesn't necessarily mean one and done because you had it some time ago. You still could have a predisposition
Hmm.
to cancer, and learning that can be life-saving not only for you, but for your entire family.